Legislature is back in session. Senator Respicio, you're recognized.
Thank you very much, Madam Speaker. Madam Speaker, notwithstanding the House rules, I move that we revert back to motions.
Without any objections, ordered.
Thank you very much, Madam Speaker. Madam Speaker, let me just move some legislative concurrences, notwithstanding the House rules, to the voting file. We have been in receipt of a committee report for Ms. Marilis Beneventi since Tuesday, and this is from Senator Rodriguez's Committee on Health and Human Services, Health Insurance Reform, Economic Development, and Senior Citizens on the appointment of Ms. Marilis Beneventi to serve as a member of the Council on Mental Health and Substance Abuse. With Senator Rodriguez's committee's recommendation to confirm, I move that that be placed in the voting file.
No objections, ordered.
Thank you, Madam Speaker. And also from Senator Rodriguez's committee, the same committee on the appointment of Mr. Ray M. Vega to serve as Director, Department of Mental Health and Substance Abuse. With Senator Rodriguez's committee's recommendation to confirm, I move that that be placed in the voting file.
Hearing no objections, ordered.
Madam Speaker, I move that we, notwithstanding the House rules, I move that we bring Resolution 87, and it's relative to adding a new Part G of Rule 20 to the standing rules of this legislature to establish a drug-free workplace policy within the Guam Legislature. I move that we bring that back to the second reading file.
No objections, ordered.
Thank you very much, Madam Speaker. And notwithstanding the House rules, again, I move that we proceed in the second reading file.
Okay. No objections, ordered. Okay. Vice Speaker. Oh, I have one. That's okay. Yeah, no, it's the Vice Speaker.
We're back on the record. We're back on the record. The next item on the agenda is Bill number 44. Speaker Wampat, you're
Thank you very much, Mr. Speaker. Mr. Speaker, I'd like to make a motion to place Bill 44-32 as substituted by the Committee on General Government Operations and Cultural Affairs on the third reading file, but I would like to discuss it.
Any objection?
Mr. Speaker, Bill 44 is an act to amend Sections 23-111 of Chapter 23, Division 2, Title 2, Guam Code Annotated, relative to authorizing the use of mileage earned through credit card purchases authorized by the Government of Guam to support off-island medical referrals and off-island student travel involving academic, sports, and cultural activities. Mr. Speaker, Bill number 44, as substituted, seeks to amend the Senator Edward J. Cruz Medical Referral Act, which currently requires Government of Guam employees to earn miles from government-funded travel to donate their miles through the Ajuda Foundation for use by medically indigent patients. However, the current program is only able to capture those miles earned by government employees who travel using a specific airline, as the Ajuda Foundation deals only with United Airlines. Delta Airlines, another carrier used by government employees, has its travel reward program and does not have any agreement with the Ajuda Foundation. Delta Airlines has, among its programs, a Sky Bonus Points program that includes upgrades for various services and seating arrangement. Excuse me. Representatives from United Airlines and the Ajuda Foundation have recently expressed their concerns regarding the Senator Cruz Medical Referral Act. They claim that miles donated to the Ajuda Foundation via the United Airlines represent only 20% of the total miles donated, with the remaining 80% coming from private donors throughout the world. DOA reports that at least 6 million miles have been donated to the Ajuda Foundation since the inception of the Senator Cruz Medical Referral Act. The current process requires employees that travel through United Airlines to donate their miles via airline's website. Employees must also provide proof to DOA that they donated their miles in order to get clearance prior to taking any other government-funded trip. DOA has indicated that there are a number of cases where the agency has waived this section of an employee's clearance form in order for the employee to participate in another trip. Government of Guam employees that travel on other airlines keep their miles. According to DOA, the federal government does not require its employees to donate their miles for similar purposes. The Department of Administration currently uses a credit card to purchase airline tickets for government employees under its purview. So far, there are approximately 10 million miles that have been earned through credit card purchases which remain unused. Bill number 44 seeks to use the 10 million miles and those miles earned by other agencies through future credit card purchases for the specific purpose of supporting off-island medical referral and off-island student travel involving academic, sports, and cultural activities. In the interest of fairness, Bill number 44 further removes any requirement for employees to donate their miles for off-island medical referrals. However, government employees and others in our community can continue to support this good cause in the future by simply donating their miles directly to the Ajuda Foundation via the United Airlines website. The bill encourages all Government of Guam agencies and departments to use credit cards to purchase airline tickets for employee travel. So far, only GWA, GVB, GCC, GPA, and DOA use credit cards to purchase airline tickets. GCC is the only entity that uses miles earned on purchases to support academic-related trips for its students. Every agency, as in the case of DOA, excuse me, and the Treasurer Rose Fairhaven, should have an employee assigned to handle its mileage account program, mileage earned specifically from the use of credit card purchases pursuant to the requirements of participating banks and airlines. So miles earned on credit card purchases are available to purchase tickets or transfer miles for flights through the following methods. 1, account holders transfers miles to patient or student's mileage account. Patient or the student then shall pay for all applicable fees and taxes, including transfer fees. 2, account holder can pay for flights with mileage from the account he or she maintains by booking the flight directly using his or her mileage account. Patient or student shall pay for all applicable fees and taxes, including transfer fees. Transfer fees, taxes, and other fees by airlines then will be borne by the approved traveler. And to give you an example of the cost of transferring mileage, Delta, it's 1 cent per mile plus $30 per transaction plus applicable fees. Maximum of 150,000 miles can be transferred in a calendar year. With United, it's $15 per 1,000 miles, plus applicable taxes and fees, the average of, let's say, $60 to $150, according to Woden from a Judah Foundation. The maximum of 60,000 miles can be transferred in a calendar year. Currently, DOA, when they charge with credit card, it is currently banked under the Treasurer of Guam. If the transfer, of course, is made, then I've already read to you what the charges could be for transferring. However, by the Treasurer of Guam actually purchasing the ticket then for the traveler, then the cost is only $60 to $150, the same way in which a Judah Foundation is also then charging 60 to 150. They're not charging, but that will be the fees from the airlines. And in order then to complete the amended or substituted bill, I would like to proffer some amendments. And on section 1, page 3, where it talks about accrued mileage, means those miles accrued by the government of Guam, specifically the Department of Administration, the Guam Legislature, the Unified Judiciary of Guam, and other agencies, instrumentalities, autonomous agencies, and public corporations, the government of Guam, that use credit cards to purchase airline tickets. I would like to add, after tickets, products and services. And the reason for that is that these agencies who use credit cards do not only use credit cards and earn mileage for it for flights, but they actually use it for other products and services.
On
And
the
that's
first,
reason, yeah.
Did you have anything
That's
further?
it, products and services.
On the First Amendment proffered by Speaker Wampat to add on line 9, products and services, any senator wish to be heard on that amendment? Any objection to the amendment?
Page
Page
3,
3, line 9.
line 9. After tickets, to add the words
Products and services.
and services.
Any objection?
On page 1, page 8, line 11, beginning with line 11, and I'm just going to read it so you can read along with me. Credit card agreement, accrued mileage program, the Guam Legislature, Unified Judiciary of Guam, the departments, agencies, instrumentalities, autonomous agencies, public corporations, the government of Guam, shall exercise due diligence to seek to enter into an agreement with the banks, with a bank or banks on Guam for credit cards to use as payment for travel for employees traveling on government and federally funded travel, and as payment for other products and services, to add those words in after travel mileage. Funded. Yes, where it says federally, I heard a different voice. Where it says federally funded travel, to add the words and as payment for other products and services, to just make that consistent with page 3. Page 3. Is to add in again products and services. No, no. Everything's same. I'm just adding these new words because in the beginning, on page 3, I add products and services. And then, so for this as well, uh, the same for purchases for other products and services.
On this amendment proffered by Speaker Wampat, I recognize Speaker Pangilinan.
Thank you very much, Mr. Chair. Mr. Chair, I just want to ensure that, now we're forcing departments and agencies to open credit cards to accrue these miles, and that may be a good policy, but I just wanted to kind of, look at also the fact that while we are trying to do this, what we're trying to do is ensure that the original intent of the mileage bank program, of course, was for medical, to assist our people in need, those people that, as a last resort, have no other alternative for medical care than MIP and Medicaid. So and if we don't if we don't use mileage to do so, then the government actually has to write a ticket for the patient and their escort. So using the miles for MIP and Medicaid had a twofold purpose. Save the government some money by accumulating these miles and paying for tickets for these patients who are there as a last resort, and we would then not have to appropriate travel expense money for MIP and Medicaid. And we don't want to just drive the cost over to credit card purchases now for everything in the government, because that's a completely different policy now, in terms of using this and putting it in here without any kind of discussion on what's the impact on the cost. Are we now going to use American Express because they give more miles, but American Express charges a service fee of 2.9%, and we're not going to use Visa because Visa is now only gives you, $1 per mile, but their service fee for the transaction is 1.5%. And so we end up now accumulating miles, costing more money for the miles by using a credit card at 2.59% transaction fee versus a 1.9 or 1.5 transaction fee. And I think if we're going to do that, I don't mind doing that, but I think that has to be discussed within the context of what's the fiscal impact to the government of Guam and our overall budget. And I don't think that I don't know, unless the speaker has thought about that, or those that are proposing to make that change now and here, or is that already being done by DOA in terms of deciding where to charge with using what credit card? But now we're saying we're driving a policy of open more credit card accounts, and doing that. And I think that's a completely different policy than what this, MIP, Medicaid, mileage travel bank that Senator Cruz had envisioned in terms of how we accumulate, and what it was meant to do was to save us some money on MIP, Medicaid, and to allow us to use the accumulated miles. And if we're going to make that kind of change here, I just have some concerns because that discussion is not occurring, hasn't occurred, and if it has, then perhaps we need to put that on the record.
Thank you very much. Madam Speaker, did you wish to address that? I see two other hands go up. Senator Morrison, and then Senator Rodriguez, and then Senator Limtiaco. You recognize Senator Morrison? Yes. On the amendment. On the amendment. Senator Rodriguez.
Good morning. Thank you, Mr. Speaker. Mr. Speaker, I share the same concerns the previous speaker had raised in terms of now if we add this amendment where we're saying now that we need to open up a credit card account for everything that we're purchasing for the government of Guam. And I too believe that maybe that's something that needs to be discussed in a different time, a different setting. The other one I want to bring up is if that if this amendment does pass, Mr. Speaker, we're saying here now that it's being used for travel and for products and services. And if it's going to pass, if the amendment's going to pass, I want to make sure that we capture everything we could if we're going to use that credit card. And so I don't know if there's if fees, some agencies, perhaps pay for fees in membership in organizations. I know with the several boards under the Guam, the licensing office pay for fees. And so I don't know now if we're saying if we're going to open up a credit card, we're going to pay for everything on it. If that captures fees and dues, is that part of services and products? And maybe to make it clear, if we're going to say that we're opening up credit card to use as payment, period, and not just say travel and products and services. So I bring that up. I don't know if we can get someone to answer that.
Madam Speaker, do you yield to the question?
Yes, Mr. Speaker. Mr. Speaker, earlier, well, first of all, that I am not saying that we're encouraging for everyone to go out and get credit cards. And I read earlier is that we do have departments and agencies already right now who are currently using credit cards to purchase not just airline tickets, but even to pay for other services. So, and I'm just adding that in now so that we can take advantage of the additional mileage that they're accruing through these payments for services or products, and that was the whole intent. Is not just then to capture the ones that they're currently using for airline tickets, but to also capture again, like I said, services and products. I did mention earlier that GWA, GPA. The idea at first when I was discussing this, was just strictly for DOA, because I knew that DOA already had been doing this, and like I mentioned earlier, DOA had accrued already 10 million miles on credit card purchases for tickets. In a conversation that I had with Simon Sanchez at the time, and he says, "Oh my gosh, GW and GPA makes charges for a lot of items," and that kind of went in passing, and then until later I had called to find out. Now they're doing this already for other purposes, and that's the reason why then the change, the substituted version now to include others who actually do provide this. GCC also charges, and like I said earlier, is that they actually then use those specific miles then to send their students off, like the culinary arts, when the students go off island to compete, those students are sent also with those miles.
Senator Rodriguez, is that?
Thank you, Mr. Speaker. Mr. Speaker, so I'm not too sure if it answered my question, and maybe I can rephrase it. So does that mean now, let's say the Guam Legislature, our body here, our home, we pay for power. I don't know how it's done. I don't know if we pay directly to GPA. We pay for health insurance for our employees. Do we pay that directly? So is this saying now that we're going to open up, or if we have a credit card, we're going to use this credit card now to pay for our power for the legislature, use this credit card now to pay for health insurance? Because I see or at least where I feel the intent is here, is to capture miles. And so we're saying that it's not just for travel now, it's for products and services. Is that what it means?
Madam Speaker.
Yes, as you all know, so when you use your credit cards and you go and you charge for gas your vehicle, you do accumulate miles on your Visa card and your Smiles card. It's not just to purchase tickets. This is not mandating that everybody go out and get a credit card now just to do this. It encourages those who are currently using it, who have credit cards, is to use those mileage.
But I think the two questions that have been raised by the two previous speakers was the fees. And unless I'm mistaken,
Currently,
GPA, if you pay your power bill with a credit card, you get, there is an additional fee. Are you suggesting
No,
that DOE pay its power bill on its credit card of $5 million to get 5 million miles, and then have to pay the 2.5% fee for the purpose of getting these mileage?
no, that's not what,
I think
what
that's,
I'm saying.
well, but I think those,
Uh,
that's the two questions that are being raised by the two, and I think you may be complicating your program
No,
a little
these
more.
are, the agencies that I mentioned already use credit cards. They go out and they charge for services, they charge for products, and they also charge for airline. So what I'm saying is that right now, in the current plan, is that it's strictly for flights that DOA does. DOA charges. They have a credit card and they charge all, let's take DOA. They charge right now all airfare flights for the government of Guam. And that's why they were able to accumulate 10,000 miles just on credit card charges. And taking that concept and expanding it now to other departments and agencies who have credit cards is to allow now beyond credit cards flight travel, so that then you'll be able to take advantage of those mileage.
Is that satisfactory, Senator Rodriguez? If not, you still have the floor. Anybody else? Senator Limtiaco, on this amendment?
Yes. Suzulas Malasi, Mr. Speaker. On the amendment, I echo the sentiments of the prior two speakers, not only in the fees that are associated with the use of credit cards, but you know, as it exists right now, and I don't understand every agency's current financial controls, but in dealing with the government in the past, there's typically some sort of financial control in the sense that the government has specific requirements that they require a PO be issued. If I charge outside or exceed the amount of that PO, the vendor providing the service is responsible. Are we bypassing certain financial controls that already exist in the government by opening up the purchases of products and services to credit cards? What financial controls are going to be put in place? And you know, specifically, you know, in addition to the fees, credit cards typically charge a very high percentage rate when you're past due on your balance. We're talking 19%, sometimes 24, 25% on your past due balance. Are we factoring in that cost as well? And then lastly, of course, goes back to our current financial state as a government, and whether or not we are financially capable to be responsible with these credit cards. I mean, if you just take a look on the internet right now and you look up credit card abuse, and you see that so many people abuse these credit cards, there's no control over it. Are we going to find ourselves? Let's take GMH for example. $22 million in payables that are due, well past the allotted 30 days that the vendors typically give them. If we open up this box to products and services and the use of credit cards, obviously maybe the credit cards will have some kind of maximum amount that you can spend on them that would deter the individual from spending more than their limit is. But I do have concerns that, you know, adding that in, opening it up to products and services, although the intent is to increase the mileage bank, and those mileage or miles are definitely going to go to some good causes, there's a cost associated with that. It's not free. And I'm concerned that we're missing the bigger picture on whether or not we can control it and be fiscally responsible with the use of these credit cards, especially when you talk about products and services. You know, we're talking millions, tens of $1 million that we're going to be spending. And my opinion is that we've already shown in the past that we are not as responsible as we should be, and this just extends that ability to abuse it and be more irresponsible with our government spending. So I object to the amendment. Thank you, Mr. Speaker.
Thank you, Senator Limtiaco. There's been an objection raised. Any other senator wish to speak on the amendment? There's been an objection raised. Those in favor of the amendment indicate by raising their right hand, please. Motion fails. Madam Speaker.
So, Mr. Speaker, then, since that amendment failed, then it doesn't make any sense with the first amendment that passed. And so we might as well then just go back to make that motion then is to just, what's the word, withdraw that amendment or delete that amendment now that had passed, reconsider then the
On the
action
motion
of
to
the body.
reconsider the earlier amendment, any objection?
Okay, so oh, thank you very much, Mr. Speaker.
On the motion to withdraw the amendment, any objection? Thank you.
The last amendment, well, another amendment then, is on page 12, and that's on line 9, where it says transfer fees. What needed to be done here is that it's not, because there are two ways I mentioned earlier, is that one, you can transfer the fee, the other is that you transfer the miles and you pay for the fees. The other is that you just purchase outright the ticket, and the only thing there in that case will be related fees, and that's what I wanted to add on, are the words "and related fees," and then just grammatically correct then these so that in the event of a transfer of other related fees and taxes are required to secure then off-island travel borne by the traveler. Like I said earlier, currently with the Judah Foundation is that when they purchase the tickets then, purchase the tickets for the traveler, the patient and a caregiver, is that there are fees to be paid, and these are borne by, and these are related fees. They're $60 to $150. It just depends on the total mileage that's to be used. So these are taxes and fees that is borne then by the traveler. So that's my amendment. And like I said earlier, and even as late or early this morning, when I spoke with Walden, who also works with Judah, is that's the dollar amount, $60 to $150.
All right, so the amendment is on page 12, line 9, after the word transfer
And
in the
no,
in the
and related fees.
and related fees.
That's
Okay.
the title. Okay,
and other related.
Yes, and other related fees and taxes, yes.
All right, so the amendment in the middle of the sentence is after transfer and other related fees and taxes. Is that correct?
Yes, and then, so we just have to make sure that's consistent then, that in the whole sentence, that if legal
The
counsel
title
then
will have to
can
be
put it in a
amended.
sentence then. But that would be like the title.
On the amendment, Senator Yamashita, will you raise your hand? Any objection to the amendment? Thank you. You've made a motion, so are you going to discuss your bill or no? I did earlier. That was it. All right, on the motion, I have Senator Morrison, Senator Limtiaco. Any other senator wish to be heard on the main motion. All right? Oh, Senator Ben. Senator Morris.
Thank you, Mr. Speaker. I appreciate the author's intent of Bill 44 and how we can look at this program to avail it to the public school system for very important activities in academic, sports, cultural activities, and how it could also be an incentive for our children to participate in these activities. But I certainly do not want to hope that these intentions go contradictory to the hard lessons of also how it can contribute to the hard work of how to earn your way to get there. We all know that we all have to, at one point in time, have to fundraise these types of activities to get where we wanted to get to. But I have a few questions that the author may yield on
Questions, and we'll see. Go ahead.
on page 5. I'd just like to understand what the rationale was behind the breakdown of how these, or the allocation of how these mileage will be broken out to these specific activities. Thank you, Mr. Speaker.
Madam Speaker, do you yield?
Yes, I do. And thank you very much for that question, because this was something that, actually came as a result of many requests to our offices for assistance. And I'm sure every one of you have experienced this, that students have come to us in their efforts to raise money to travel for Close-Up. That was the most recent, was for Close-Up, and it's a very good program. And I have to say that, it does, kind of pains all of us to not give as much as, we would like to, and as much as they need. So when in my discussion then with DOA, that there was this 10,000, a separate 10,000 miles, 10 million miles, sitting there, and the other mileage, our traveler mileage, are all going into Ajuda. But then there is this 10 million miles. Then when those requests were coming in, I tried to find something that's really closely related to the agency and the different activities that our students are going to participate in. For education, I know a lot of it is more for academic activities, and that's why I listed like Close-Up, Junior Statesman's. There's other programs that they have, like Spelling Bee contest. Majority of the students traveling and raising money are for sports, and that's why I listed the other departments are much bigger, and a combination of them not knowing exactly how much they have accrued. That was the only one, of course, in which I can't honestly say is totally related, because it's just what's available. In my discussion with the courts, that they were saying that they had wanted to use their mileage to take care of the mock trial, the students and the National Forensic League competitions. So that's, why that in particular, those students are, that the mileage accumulation will go to those specific things. So cultural activities, what's the most closely related to it was the Visitors Bureau, and it has to do with travel, the airport travel, Port Authority travel. So that was the rationale in which I tried to closely relate the activities of these for the children with the departments and agencies.
Does that answer your question, Senator Morrison?
Yes, Mr. Speaker, but I wanted to share a little concern that I have there. Of course, I do come from the sports arena. I know there's a large pool of travelers out there, and the breakdown here is that there's a lot of important other activities within the school system. Of course, if it was totally up to me. Yes, sports will be prioritized, but I know my colleagues trying to be very fair in the process of allocating the mileage to the specific activities. We'll see how, I guess, the program works with these activities, and see how. My thought was more of why don't we just cut it down the middle, put it onto one pool, and have the superintendent figure it out for all the activities within the school system. But I appreciate my colleagues' answer to this question and how she tried to justify these activities and the large pool of these activities. But we'll see how the program works and maybe revisit another time. Thank you, Mr. Speaker.
Thank you very much, Senator Morrison. Senator Limtiaco.
Mr. Speaker. You know, it's difficult to get up here and speak against a bill that attempts to do so much good. And I believe that the original intent of the law was for cost avoidance by allowing for the use of miles as opposed to just purchasing a ticket for the medical travel. You know, and I know what the authors are attempting to do with this bill, and it's very worthy and a very good cause. But it begs the question as why are we not using the miles for government travel to begin with? Why is the mileage usage that exists in the government right now not utilized over a government employee who wishes to travel just purchasing a ticket? Because that seems to be in line with the original intent, was the cost avoidance. Rather than buying a ticket, let them utilize the mileage first, if it's available. If it's not in those blackout periods, that would be cost avoidance. That would go good towards reducing government spending as well. Rather than just buying another ticket, see if the bank has enough government mileage so that these government officials can travel on official duty. It's the government that's paying for the miles originally. So it just begs the question, not to take anything away from the bill or the original law, because it has great intent. There's no doubt that there's no shortage of worthy causes that could utilize this mileage. But if we go back to who is purchasing the tickets, who is using the credit cards, where's the funding coming from? It's coming from the taxpayer. The taxpayer is the one funding it. And if we are going to attempt, as the original intent of the bill, for cost avoidance, it's my opinion that they should be using that mileage bank before a government official attempts to purchase a travel ticket. They should be looking to see if they can utilize the mileage first. Now, if there's a bunch of mileage left over after the fact, I can see this bill applying to all those miles, because we don't want them to go unused, and if it's for a worthy cause and there's no shortage of them, they should be utilized. But I just wanted to spark the discussion, as I don't know if anybody's brought it up, but why aren't we using these miles right now for government travel to begin with? Because it would seem that we could avoid some cost saving, or we can have some cost savings by utilizing the mileage first before purchasing a ticket. I'd also like to bring up just maybe a point of clarification, because I may be missing something. But there was an amendment made before the main motion to discuss the main motion, and it was regarding the fees for the travelers, and if the author would yield to a question regarding that. The bill in its current state is going to require every traveler who is traveling on government business it requires them to donate their miles. The amendment that was made, although the original law had it in there, regarding the transfer fees and any other fees, can you please explain, is the government paying for the transfer fee, or is the traveler themselves paying for the transfer fee? And if it's the traveler themselves paying for the transfer fee, why are we penalizing them for travel that is being done on the government's business. And I just may be missing something, so if the author can yield to that question.
Do you yield, Madam Speaker?
Yes, Mr. Speaker, and thank you. Thank you for the question. The arrangement that was made with Continental then was that there would be no transfer fees at all. But there is still other taxes and related fees that still have to be paid by the traveler. So that's still there. And but this is something new now. It's actually using the credit card purchases. What you're addressing here currently is that it's the traveler's own mileage that actually gets banked into the United website that a Judah will be able to draw down for a traveler, for those who are medically indigent, and recently because of the amount of mileage that they have, that they've actually expanded it now to include individuals who are still in the indigent level, but it's to include Medicaid. Medicaid or Medicare, one of the two. And if I may at this time, because I know you had had asked the question, why aren't we using this existing mileage for purchasing tickets? For other departments and agencies who don't, it's either they just contact a travel agency, send them a voucher for the mileage. And then I know now recently there's this credit card purchases that are being used. So, and they've been sitting there because nothing had been, it was something, I guess, that's fairly recent, in which they've been accumulating all these mileage, and meaning the last, I think, 5 years is since the program. I think it's 7 years, I'm not sure how long the program's been in existence, but it's the mileage only of the traveler that's being currently being used to purchase tickets for the medically indigent program, not necessarily for, it didn't say for future government employees' travel.
Does that answer your question?
I'm not sure if it answers the specific question regarding the traveler themselves. And so if we're requiring the traveler to donate their miles, we are asking the traveler then to, out of their own pocket, pay for these transfer fees?
I think the problem that you're having is there's two travelers. There's the government traveler and there's the beneficiary traveler.
Right.
So you may need to have to distinguish that, because the government, there is, if it's me,
So in that case, good.
I'm not being asked to transfer when I give up my miles. I'm not being asked to pay for it. But if
No,
it's
that's exactly what I said.
But the student or the patient will have to pay the transfer fee, not me, the government traveler.
When the
Is that the
government,
question,
no,
Senator
when the
Limpiaco?
employee transfers their mileage into the United website bank under a Judah, there is no transfer fees. Now, when a Judah then now is going to draw down on that, they have to pay, I mean, the passenger pays for the taxes and other related fees, but not the transfer of it. And that's why I said the dollar amount is $60 to $150, depending on the amount of, travel mileage being used.
I see. So then you're correct then that the beneficiary of the travel pays the fees. Okay. So, okay.
Thank you.
That answers the question. Thank you, Mr. Speaker.
Okay. Senator Pangilinan, you're next. And then Senator McCready, and then Senator Rodriguez, then Senator Yamashita.
Thank you, and just Masi, Mr. Speaker. Speaker, perhaps I need to just maybe shed some light on the creation of this medical mileage travel bank for the specific purpose of helping those members of our community who have no other way of accessing off-island health care except through the MIP and the Medicaid program. These members of our community are enrolled into the program based upon, of course, eligibility, income eligibility, resource eligibility, and the government pays for their health care because they don't have the capability, capacity at the time that they need these crucial health care to pay for that on their own. They're not insured by a commercial insurance company and don't have any other resources. And when we looked at this, we then said, who pays for the travel then of that individual that is now under the MIP and Medicaid program? And the government actually appropriates the money to the program that now uses government resources, government funds to pay for travel to access the healthcare off-island, required healthcare off-island, that if we did not pay for that travel, if we found a different way of paying for the travel, then we can have more money for MIP and Medicaid for actual health care. Because we are always short, as you know, with regards to MIP and Medicaid. They're always saying that, you know, we have to reappropriate money, we have to find additional money, the increase in costs. And so how could we have more resources available for the medical component of MIP and Medicaid? And one way is if we didn't pay for the travel costs. And where could we get government resources to pay for that, to give them travel access without having to dole out the cash and appropriation for that? So that's when I originally created this mileage travel program. And with Dr. Cruz, Dr. Eddie Cruz then came to me and said, you've been working on this medical mileage program, you know, I want to do something a little bit more. And so he introduced the bill that would do it, that would actually take the miles accrued from government travel in order to now use those miles to get free tickets from the airlines that would now allow us to use the money that would have gone to tickets to healthcare itself. So we can help more people without incurring more costs. And so we started that program, and the Wings of Life program that was started by one of our good colleagues in here with the Azuda Foundation had worked hard to get the Wings of Life program and the Azuda Foundation, because Continental at that time was on the board of Azuda, I think one of the management team. And so they adopted this Wings of Life program to place on their website, Continental Airlines website, mileage, One Pass website, where members of the community across the world really can now take miles and donate it to Azuda Foundation for the Wings of Life program. And they would waive any transfer fee associated with putting the miles into the Azuda Foundation Wings of Life program that would otherwise have to be paid. If I, as a One Pass holder, had miles and I wanted to give my miles to a traveler or to any other entity, I would have to pay a fee to file that, and that fee could be substantial. I think it's something per 1,000 miles. So if it went to the Wings of Life, that fee is waived. So I can be charitable and not have to take money out of my pockets to pay for the transfer of the miles. I could just transfer it. So it made it easier to donate to Azuda because of the waiver of that fee. So setting the program up, Dr. Cruz then said that if we could work out an MOU with Azuda, with MIP and Medicaid, that with Department of Public Health, then we can transfer miles accumulated from the employees who travel now that would then have them donate to Azuda as a condition of their travel, and then Azuda will then work with the patient and facilitating the issuance of the ticket. Now, you know, a great thing is being made by the idea that we have 10 million miles that's sitting there and we can't access those miles. Well, one of the problems that has been that has hindered the transfer of these miles and getting these patients off island quickly, they're saying that, well, we can't really access those miles, and we have so many miles right now that we don't need 10 million miles for MIP Medicaid patients. The problem is that, you know, it takes a long time to get your travel clearance. So by the time the patient needs to go off island, and they process the travel authorization from public health to DOA to the governor's office at BBMR, that patient, the blackout period, whatever, may not be able to, may have to leave. And so they find another way, or we issue a ticket and write a check to cover the cost of that travel because we can't access the miles because of timing. Well, the thing is, because the travel authorization using miles can't be facilitated because it gets stuck in the bureaucracy of the process. So we've been meeting with DOA trying to unstuck that process so that if you're going to issue a ticket for an MIP recipient that's being, you know, a Medicaid recipient that's being referred off island, and you're going to be able to get a free ticket, why send it to BBMR for budget clearance when there's no cash outlay? Why not just have DOA say to, public health, here's a patient, they're eligible for MIP, we need a ticket, how many miles you have, go directly to Azuda, and there's cut out, you know, 10, 15, 20 days of processing time that now can facilitate issuance of that ticket so that the patient can travel and meet his appointment time. We're trying to unjam that bureaucracy there. The other thing is that we got 10 million miles. You know, that's almost, you know, 5, 10 years of accumulation of miles. So we don't accumulate 10 million every year. It depends. We accumulate maybe 1 million. I don't know what that number is, but it certainly is. This 10 million miles is accumulation over the years. And we seem to think that 10 million miles is 10 million tickets. It isn't. 10 million miles, if it was 60,000 miles a ticket, is really about 166 tickets. If we're accumulating, you know, that's just based on the credit card purchase. If it's 1 million miles a year, you know, that's 16 tickets. That's 8 patients. Because a patient and an escort are paid for. So it's not like, and so next year we're not going to have 10 million miles if we just dole this out to all the other programs. You know, we're going to start with 0, and then we're going to start accumulating. And are we going to accumulate? How many patients can we help then at MIP and Medicaid? Because now we're cutting it off. And I'm not sure, but I have to take a look. Now we're also saying that the employee, the actual miles traveled that you would accumulate is now not going to be required to be donated by the employees. So now the only miles we have is credit card. And I'd be mistaken, and now, you know, I keep trying to read it to understand some of the amendments made, but my understanding is now we're saying don't have the employee donate their miles to the Ajula Foundation. Let them keep it, which now cuts out. The miles that you get on a credit card is probably $1 per mile. So for every dollar you spend, you get a mile. But just think, the majority of this could be from the miles traveled. Because if you travel to Washington, D.C., it's 5,000 miles. But the ticket cost is only 2,000. So we are now going to lose the 5,000 miles of actual travel and only going to get the 2,500. So we're not going to accumulate as many miles anymore. So now, how many patients are we going to be able to help? 2? 3? You know, the mayors are considering a bill this year from one of my colleagues on panhandling, trying to get rid of these individuals who are out trying to raise money. And what do you see on their sign? It's for medical care. And they're out there, and most likely, and in most circumstances, they're MIP Medicaid patients who are trying to raise money for, either the ticket, or the ticket's going to be covered, but for their health care, for their living expenses, trying to get off island. And they can't, sometimes we write them a ticket, but they can't leave because they don't have the resources to pay for their expenses. So they're out there. So now, we're now going to complicate this issue a little bit more. The original intention by Dr. Cruz, and that's why I decided that when I made the amendment to this bill to capture more miles, was, to honor him for his concern for the MIP and Medicaid patients. And that's why it was called the Medical Referral Mileage Bank. And now we're coming back and adding education to that. If we want to create a program for education, then perhaps we should at least have some respect for Dr. Cruz and his original intent, and just create a different program for education miles. Don't amend this Medical Mileage Bank, Senator Eddie Cruz Memorial Medical Mileage Bank, and now put education in, because that wasn't his vision. That wasn't his concern. He was a medical doctor who saw patients struggling to go off island, under MIP and Medicaid. And also, the government struggling, in my discussions with him, articulating the fact that the government is struggling to provide more money for medical care on that side. And how can we marry the two concerns to ensure then that we get these patients taken care of? And the next patient that's due for a medical referral, we can sign off because we have more money for the medical aspect of his care, because his ticket is going to be covered by this medical mileage bank. And so that was the intent, and I would have hoped that if we're going to create a completely different program for education, then let's create, maybe be the Gloria Nelson, mileage bank for educational, maybe do that and carve it out and take it away from, we are now taking miles away from and we don't even know, how much we're taking away. We don't know the effect of it. The other hidden factor here, I think that's not being said, is that we're getting rid of the medical mileage bank and of accumulating the employee travel. And from what I understand, we've had visits by United that United is threatening to take Azuda off their website because they believe that employees are now avoiding traveling on United and traveling on competing airlines because the employees keep their miles on those competing airlines. That is what they have represented to me in my discussions with them. And so they say, if we don't allow employees to keep their miles when they're paid for by government funds, to keep their miles on when they travel United, they're going to shut down the Azuda Foundation website, Wings of Life program, in terms of allowing no transfer fee donations. If it was true that employees are actually now avoiding United because they have to donate their miles to the Wings of Life program, then perhaps, that is something that we need to address. That we don't, as we argued the other day in terms of leasing government lands by these autonomous agencies, then our program of capturing these miles is creating an unlevel playing field between United and the other airlines, because employees are now going to decide where to travel based upon where they can keep their miles. We're trying to work with Delta to kind of do the same and mirror the Judah Wings of Life Foundation with Delta. They're resisting, but we're trying to talk to them and trying to convince them that this is a great program that really doesn't cost them anything, but brings a lot of goodwill and will help them in terms of their corporate generosity save lives on Guam by providing, accessible tickets using these miles programs that would have otherwise been redeemed by the one pass holder anyway. So it's not like saying they're now going to, have to shell out more one pass tickets because they're part of the program. Those miles are based upon actual travel, not undonated travel or unearned travel miles. So, but the claim that employees are going and traveling on Delta or any other airline because they can keep their miles there, is not allowed by the current travel policy of the government of Guam. Because the current travel policy of the government of Guam is that you submit your itinerary, you get the quotes from the airlines that you want to travel on, and then Department of Administration authorizes the travel based upon the lowest fare available. So it's not possible. I'm not saying it can't be done, but it should not be possible, and the policy doesn't account for that. So the policy that we have of where an employee will travel cannot be based on where he's going to get his miles and get to keep him. It's based upon the available fare for that travel itinerary that is lower than the other fare. So this idea that Continental or United is at a disadvantage because employees have to donate their miles or give up their miles when traveling as United that's not what is based on the decision. The employee doesn't make that decision. Department of Administration makes that decision in reviewing the itinerary and reviewing the cost of that travel. So I'm hoping that clearing that up, will cause United take a look at it, because the Wings of Life program is a life-saving program. For me, it's a great, great program. We thank United for its generosity. But to pull the program because they think it negatively impacts the decisions that employees make on whether to travel United or not is not allowed by the travel policy of this government. So it is based on competition, based upon price. And that's the determining factor of where employees traveling on government travel can go. There's the suggestion that, well, we just, that the Wings of Life gets so much miles from everywhere else, and they don't need the one pass mile or the government travel miles. They don't need them. They can take care of their patients and so forth. We entered into this arrangement with Wings of Life because it allows us to transfer the miles there without a fee, And so if Azuda says we don't want to do it anymore because it threatens our program, then I think they definitely have, should look at it and see can do that. But they cannot blame the fact that we're accumulating miles of the employee as the reason why, United may have suffered a little bit in terms of a loss in government travel. It's definitely not because employees can keep their miles on Delta and not on Continental when doing, or United when doing government travel. And it would not be fair to the concept that we have here to have them make that kind of decision, knowing the fact that the policy doesn't allow that to occur. And so I generally, the other thing is, and I look at, again, we got caught up in, man, they have 10 million miles and they haven't accessed it. The bureaucracy has prevented us from accessing it more quickly. We're trying to unjam that bureaucracy right now. 10 million is over years of accumulation. It's not 1 year. And what's going to happen when we take 10 million miles away from the MIP Medicaid Travel Bank, basically, give it to other deserving institutions? Number one, it doesn't meet the original, it doesn't result in a cost savings to the government of Guam, because we don't appropriate money for travel, for close-up, for travel for sports teams, et cetera, et cetera. We do not appropriate money at this time, so there's no cost avoidance on that. It just takes it away from a program that allows us to help those that need the most help in terms of accessing medical care off island, away from them, reducing the capacity to serve more patients there, and then it also takes away the opportunity for this government to avoid the cost of paying cash for travel and taking that payment that would have gone to travel to service more patients by putting it into healthcare services itself. And so that's really the reason why. You know, this idea of trying to use some mileage bank and some government resources to help our students and so forth. Madam Mr. Speaker, you know, I originally came up with the idea and actually introduced the bill to allow us to access these kind of programs. Uh, but, but at that time, we actually had appropriations to the off-island sports funds. And so when I created that program, I required that those individuals who are going to access that program would have to match the program, continue their fundraising activity, but we would match them, you know, dollar for dollar. For every money they raise to support their off-island travel, this government will give them $1 to help them support it. And I did that based upon, you know, just service learning. Service learning, we were thinking and working on that since back then. You know, that how do you help yourself? Well, you go out, you fundraise for your group, and that's a service learning thing. And we would then help you in terms of achieving your goal by matching what you raise. And that's how we help these off-island programs and so forth. And so that's where this original concept came. You know, again, we're seeing other people jump in and step in and help our students. We're seeing now the Close-Up Foundation through the Department of Interior is now awarding, I think, 10 scholarships for close-up recipients that, you know, assist these students. The other thing that I have is, how do we decide which students and on what basis are they going to be eligible for these miles? You know, if we're going to do all this, then, you know, what's the criteria? It was very easy under MIP and Medicaid in terms of how do we decide how to use this government resource to help the people. And it was because we knew that there was a criteria in terms of income requirement, income resources, you know, economic resources for these people to go off island for healthcare. And when they get part of this, we know that they can't afford it any other way. We know, and so therefore they become eligible for this. How do we decide which student, you know, is in a better position to pay for that or can raise more money? And which one do we help? Do we help the student that is on free lunch, you know, or do we help the student that is on reduced lunch? Do we help? I mean, is that the priority we're going to have in terms of who needs the most help? How do we decide that? And how many students are we going to be able to help and who gets it? Because even if you take all of these miles in here, again, it's about 60,000 miles to the West Coast, I think, per free ticket under mileage. And, you know, how many students travel off island? You know, 1,000, 2,000? And we're going to be able to help 50 of them? 16? 10? How do we decide which 10 get it? We know under the MIP program of how do we decide that. It's those who need the health care at this time that qualify for this program will issue you a ticket, and we work through that. So the way that the program is set up, I think all of those questions to me still raise in my mind in terms of setting up that program. The other thing is, so now we're taking all the miles that would go to MIP Medicaid, and only the ticket, the credit card at DOA now goes to that. How many miles is that? Everybody else in which would have supported the MIP program is now going to go to other programs, education, cultural, and so forth, which is all good. But that, you know, really impacts how many people we can help in MIP and Medicaid, you know. And so to kind of continue to say that we're supporting the mileage program, the Senator Edward Cruz program, you know, by throwing education in there, I think, you know, is unfair. And that if we're going to take away the miles to support the MIP Medicaid patients, I really don't think we should do it by amending this. I think we should do it consciously, openly, and let these patients know that they're going to be affected by it. because we're creating a completely different program which will now, take away the miles that could have come to you and so forth. And I really think they have to know that. They should be told that. And I don't know if that message, that is out there. So I love the intention, I want to help the students. I've tried to help them in the past by passing legislation such as the off-island sports program and setting that up. So I always try to look at ways, but I'm a little protective of this program because when I amended it, I wanted to solidify the intent and the concern of Dr. Cruz in terms of what he was trying to do, and named it after him, and to have it come here and then have half his program chopped off, and still keep his name associated with it. And now it's educational. I just don't know. I know he's concerned about education, but I think the priority was how do we help those that are most vulnerable in our community that he was seeing day in and day out in his medical practice. And I want to kind of keep that a little bit more pure, a little bit more separate from, other programs that have access that would now take this, what was meant for the program, take it out and put it in and so forth. And I always prefer that it be done that way rather than folding it into what his original intention was, which is now just kind of obliterated, I think, by this program in terms of the resources available and what it was meant to do. So I continue to try and take a look at how we can do these things to try to help as many members of our community as possible. And I just have some real concerns in that. The biggest concern I have is, Continental United saying that this program has hurt their business because it's just not true. And that's why we're changing the program because it's hurting United. It's just not true. And if Azuda Foundation is saying, well, the only way we can work with you on this is if you allow the employees to keep their miles, we're trying to do that. How can we expand it for other cost avoidance with just regular Guam travel? We're not going to be able to do that at all because we're going to be barely able to help the MIP Medicaid patients. But if Continental or United is going to make the choice to sever their relationship and shut down the Wings of Life program as an adopted charity, I think it's completely unfair of them and certainly incorrect of them to blame this program of driving travelers away from United to other airlines because it is not allowed under the government travel policy. The decision is where can we get the best price for the government dollar in paying for travel, and not where can employees go and keep their miles, and the government will pay for those miles and let them keep it, and we're going to pay a higher fare just to do that. We cannot, and it is not done in the current travel policy of this government. And again, if it's just credit cards, every travel is almost twice what you would pay on the cost of the biggest support that can come from this program is the actual miles traveled, and if we're going to give that up, we're definitely going to just reduce our ability to help MIP Medicaid patients based upon just the credit card purchases. We may only be able to help 4 patients a year, 8 patients, 16, and that would be a shame. Thank you very much, Mr. Speaker.
Thank you very much, Speaker Ben. Senator McCready.
Thank you, Mr. Speaker, and I agree with the last speaker's sentiments, and I commend him for his leadership in wanting to help the people who cannot afford to go off island and for medical reasons. I also want to commend our former Senator Carlotta Leon Guerrero for facilitating this program and making sure that this website and the miles get used in a good way. We've moved over 500 patients since 2006, and another 500 caretakers with them. So the question isn't whether or not this program works. This program works, and we need this program. But I think the big question that we have to ask each other is how does this body ensure that the program and the 9.6 million miles that we already have in an account and future 9.6 million miles, how do we ensure that we don't lose it? I don't think we can afford to lose this program. You know, I commend the author of this bill for introducing and even expanding this program. But I still think we have to make sure that the pipeline to the Azuda Foundation doesn't get interrupted. At the end of the day, these people who can't afford to go off island to save money and save lives, I think it's important. We have to address that issue. I also believe that if you read and you listen to what's going on, and if you listen to what the former speaker said, we're kind of backed up into a corner here. I think that I would like to ask a question to the author of the bill. Is this a type of legislation that we are forced to introduce or lose the program? Are we backed up into a corner? Is this body backed up into a corner to pass legislation or lose the program? And if we are, I think we have to navigate in that sense so we don't lose the program. So my question is, are we forced to pass this legislation or lose the program?
You yield, Madam Speaker.
Yes, and thank you very much, Mr. Speaker. When this was first brought, yes, to my attention, it was through United Airlines and through the Ajuda Foundation. And I wanted to get more information first before I decided to introduce the bill. And while I was getting the information, as everyone know, the original bill that I had introduced was strictly for just the credit cards, mileage accumulation, and not touching yet the travelers' mileage. But after speaking with Delta, trying to get them to, first of all, is try to participate the same way that United Airlines is, so that then we can have a level playing field here for the airlines and for all the travelers. But Delta came back and said basically that they have no mechanism as a private entity to come out and say and enter an agreement with the government of Guam to say that, because when they give their mileage, it's given to an individual. By the same token, United also was able to do that. So, I can't quote exactly what was said, but we were informed that by United representative on island that if we don't amend the law to repeal the part where we mandate that all employees donate their mileage, then in their website where they give mileage, they listed Ajuda for anyone in the world to donate mileage, that they would remove Ajuda. Hence, of course, Ajuda would end up not then being able to continue to get any from government of Guam travelers. In my discussion with them again, they said that 80% of the mileage come from all travelers throughout the world, and that the remaining comes from the government of Guam. Now, I know DOA said they're unable to quantify specifically what it is, but they say they do a lot of waivers, so therefore the mileage do not get deposited. And their worry was, how are they going to go to an individual's paycheck and penalize the traveler by taking back the money for whatever the trip had cost, when the only time they're able to garnish any of the checks would be through only for taxes. So that was a difficulty on their part. So yes, eventually then I had to amend it because of the fear of not wanting to lose whatever miles that Judah would be able to avail from other travelers throughout the world, not from GovGuam travelers. Hope I
Thank you.
was-
Does that,
I rise to a point of information, Mr. Speaker. Mr. Speaker, we are backed into a corner because United is saying that they are losing government travel business because employees traveling on United have to give up their miles. That's why they're saying that that's why they want to do that. And if we don't repeal the law that employees must give up their miles when they travel on United, that they will then remove Azuda. But that's not true. Because if that's what United believes, that's what they believe, it's not true because you can't travel on United if the fare on Delta is lower. That's what decides where the government employee is going to travel. Not that he can keep his miles on Delta, but the fact is that the mileage, the cost of the airfare for the same itinerary is lower on the other airline. And that's the travel that DOA approves, not the employee. So if you're not, I don't know, so if they are saying they're backing us into a corner based on something that's not a fact and has no impact on their business from government travel point of view, based upon an employee having to give up their miles when they travel United, because that's not at all entered into a decision of which airline that employee is going to use. The decision is made by DOA based upon the cost of that airfare and not on whether or not the employee can keep his miles.
thank you very much. You've had two senators address your question. Did they answer your?
Mr. Speaker, I disagree with the former speaker. I don't want to get into costs, but I think Delta is a little more expensive than United. I don't want to get into costs, like I said, but my whole intention is to allow this body the information, or to allow this body to know when they vote on this bill that we're forced into a situation here. And like the former speaker said, we're backed into a corner. And whether who's right or who's wrong, at the end of the day, a program that saves lives is in jeopardy. And I think that we, as leaders, rather than putting the blame or negotiating with another company which the former speaker said they are also giving some pushback, I think we need to preserve this program in any case or in any scenario possible. I think it's our responsibility to look after the most vulnerable, and in this case, it's the people that can't afford to save their lives to go off island and see a doctor or get medical treatment. So I think I guess the question was answered by, the former speaker, he hits it right on the nose. We are backed up into a corner. I just want to make sure that at the end of the day, that we don't come out swinging and lose this program. So yes, my question was answered, and thank you very much, Mr. Speaker.
On the motion, did you have anything else besides yielding to that question, Senator McCready? That was it? The next one, Senator Rodriguez.
Thank you, Mr. Speaker. Mr. Speaker, with this bill, there's so many different components, I think, that is part of this bill. The first one I want to just speak about, and it's the intent of the authors of this bill. And I of course, commend them and congratulate them for having this vision of how can we also assist our students, our young folks, go off island. And of course, that's something very important. However, when you look back at the original intent of this law, Mr. Speaker, it's something we must, we must keep in our minds that was meant for our people in the community who are going through very, very tough times in terms of their medical health, in terms of medical needs that they need to get treatment off island. And these things, Mr. Speaker, happen, these things are not planned. When you go to a doctor, and doctor tells you, you're in a bad situation, you need to leave tomorrow. You need to leave tonight to go seek treatment. These are the individuals, Mr. Speaker, that currently in the existing law, these are the people it benefits. For the expanded use now of these miles that's being proposed in this bill, these are for students, these are for our kids that know 3, 6 months, a year in advance that, there's a competition that's happening, and we need to plan for it. One of our good colleagues here who's a sports guy says too that, this is something they know. They plan for these things. They fundraise for these things. This is something that they need to work for. And so that one component, Mr. Speaker, of this bill now expanding it into use for education and for sports use, to me it's really concerning. Not that because I don't think it's important, but because the intended use, I'm sorry?
No. Can you take that discussion outside so the speaker can speak uninterrupted, please? Thank you.
Thank you, Mr. Speaker. And so the intended use of this law, Mr. Speaker, needs to be protected. That's something that we must all do here. The previous speaker just said that, we need to do what we could to preserve this program. And the other component here, Mr. Speaker, deals with preserving if in fact there is a real threat by an airline to end a program that's been going on for years. I was reading the committee report. I saw a testimony from the Azuda Foundation that says that provisions in law need to be changed in order to, so that the program is not jeopardized. Then if that's the case, Mr. Speaker, then maybe we need to keep that part of this bill intact. Leave that part where it says we're not going to jeopardize the program. However, I believe we need to make sure that we preserve the original intent of the law, which is to take care of our people who are in need of medical treatment. And so I would like to proffer some amendments, Mr. Speaker. On page 2, before I do that, I want to speak about how this amendment here now on page 2 starts with line 4. It says medical referral and education mileage program. There is hereby created within the government of Guam an accrued travel mileage program for the use of travel mileage earned as a result of travel paid by the government of Guam, and the the addition here is to the use of government of Guam credit cards. To me, Mr. Speaker, what this means is that the only time now we're going to accrue mileage is to credit card use. And this was brought up earlier about perhaps there's some questions whether it's only you can only accrue it with a credit card, and I think it's very clear here that it's saying that you can only now accrue it through the use of the credit card. And so now, if I'm a government traveler, the miles that I accrue will not be deposited into the program. And so I want to make the amendment to strike out to the use of government credit cards. This way, Mr. Speaker, it ensures that not only is the mileage being accrued, not only is it through the use of the payment of the credit card, which could be anywhere from $1,500 to $2,500 versus, as the previous speaker said, if you travel to DC, it's about 5,000 plus miles. So I want to make sure that the mileage that's accrued on the travel itself is preserved and not just captured through the use of the government credit card. So I want to move to strike that off, Mr. Speaker.
All right, the first Rodriguez amendment is on page 2. and that's on line 8 to remove the proposed amendment underlined as through the use of Government of Guam credit cards and have a period after travel paid by government on paid, Government of Guam on line 8. Is that correct, Senator Rodriguez?
Yes, Mr. Speaker.
On that amendment, I have two hands up, Speaker and then Senator Ogden.
Thank you very much, Mr. Speaker. Mr. Speaker, I rise in objection to this. When you remove, the whole idea here is that we have 10 million miles right now from credit card charges. And by removing this, then we don't have, the Department of Administration will not have a mechanism right now to be able to transfer and to use those mileage accrued, those 10 million miles right now, as a result of credit card charges. What this also does is that then, by removing that, and I understand where he's coming from because I know the language further down actually, repeals that portion where it's mandatory now for travelers to bank their mileage. But there is language that instead of making it mandatory, that now it is also voluntary for those then who want to provide their individual mileage, travel mileage, versus credit card mileage accrual. So, and by removing that, then in essence, we will not be able to use those credit card mileage, and we're back again to where we are today.
Senator Ogden?
Thank you very much, Mr. Speaker. Mr. Speaker, I just, and I thank you for not kicking me out of the room, but I just leaned over to the sponsor of the amendment, and I had a very brief conversation. There's two ways in which you can accumulate mileage. Obviously, it's through the initial purchase of the government fare for that particular trip. But the sponsor of the amendment also highlighted that when you actually take that trip, you also accumulate miles between Guam and your respective destinations. And I think that that's really where he would like to capture both components. And in terms of, I was recommending that, in fact, he just delete the words Government of Guam, but he's absolutely right. There are two ways in which this particular program can benefit, is not only the application and the use of the credit card, but really the mileage that is gained as a result of that particular trip. So I think that just by virtue of deleting that provision to the use of Government of Guam credit card, I'm trying to figure out, and I still have yet to decipher whether that would be sufficient to include both components. Because if that's the case, and that's a desire of the sponsor of the amendment, I think that if it's unspoken, it can be interpreted 5 different ways, right? Or I'm sorry, it can be interpreted differently by 5 different agencies. But if what he intends to do is to capture both aspects, then it may have to be highlighted here to reflect either credit cards / and mileage earned as a result of that particular travel. So I just wanted to share that perspective, because now I have a better understanding of where the sponsor of the amendment is coming from in terms of making sure that both components be included in any deposit of mileage into the mileage bank. Thank you very much, Mr. Speaker. And no, I do not oppose the amendment, but I do still need to decipher exactly what direction I'm going to take, only because of that, what I just shared with you. Thank you very much, Mr. Speaker.
Any other senators wish to be heard on the amendment? If not, oh, wait. Senator Ben.
Thank you very much, Mr. Speaker. Mr. Speaker, I kind of, want to make sure that we're bringing accurate information here. And we seem to think we can't access that 10 million miles right now, but I don't see why we can't, because according to the sponsor of the legislation, that 10 million miles goes to the name of the treasurer, whose credit card for the mileage affinity credit card is under the name of the treasurer. So the 10 million miles is in the name of Rose Perez or whoever our current treasurer is. Now, Rose Perez can transfer 60,000 miles to, can buy a ticket, can use her 10 million miles to issue a ticket to somebody, and the fee is $15. So we can actually use that for the Medicaid MIP patients. Why we don't is the question. So to say that we can't, we're going to just have that stay in that bank forever without ability to access is, I don't, unless I'm mistaken, I don't believe is an accurate statement that we can actually use that and just have Rose Perez, personal owner of 10 million miles, you know, the $10 million woman in the government of Guam, issue a ticket using those miles under her name without the need to transfer it to Atsuda. She can just issue the ticket. Because that's how we're going to do it with the students when we put it into the education account. That the person whose name is in the credit card now can just use that to issue a ticket to the students. So if we can do that when we take those 10 million and put it in education, why can't we do it now when it's there for MIP and Medicaid? So that's why I think, you know, we can access that.
Thank you very much. And
the other issue I want to say is that we are required, or the employee traveling on United, this is the current statute now. The employee traveling on United is required to give up his government purchase miles to the Atsuda Foundation. And the reason why it goes to Atsuda, because the miles actually have to be transferred. So he transferred that miles, and the Atsuda Wings of Life is able to receive that without a transfer fee. If the employee, the current statute, and this is the other kink in this that we're trying to get implemented, if the employee travels on any other airlines, and he has his miles and he accumulates it, and he wants to keep it, he has to buy those miles. He has to pay the government of Guam money for those miles now. And the money that he uses to pay to keep his miles goes to MIP Medicaid. If the employee traveling on United doesn't want to give up his miles, he can also pay what is the cost that it would be to buy that amount of miles, and that money goes to MIP and Medicaid. So this idea that, you know, we're being blackmailed, we're being strong-armed into changing the law because United believes that the reason why government travel is moving over to competing airlines is because employees have to keep their miles. If they want to keep them, just as if the employee flying on Delta wants to keep his miles, he has to pay for those miles. That's the current law. If we implement it, everybody's on a level playing field. You can travel wherever you want, you can keep your miles wherever you want, but you have to pay for what the government paid for you to earn that mile and send it over to MIP and Medicaid. So that's how, when we worked through this, when United brought those concerns to us, that's what we put in the law when we amended it to ensure it doesn't negatively affect United, and it's on a level playing field. So the employee on United, if he doesn't want to give it up, can pay for the cost of keeping those miles, which the government paid for. And if he's traveling on Delta, he also must, and keeps those miles, he also must pay what it would for what the government paid for him to earn those miles by purchasing those miles. So I think if all of this is done, maybe United might have a different perspective on why, you know, employees are traveling on other airlines, and it's not because of this program here. That's the thing is, they, you know, United Continental, when they implemented this program, did so with great intention, with compassion, with good corporate citizenship. And now to say that all of that is now going to be wiped away just because this is happening, when that's not the case, when it's not this program that may be causing them to lose their business in terms of government travel, that this has nothing to do with that decision. And to punish Atsuda and to remove them, you know, would be totally unfair to Atsuda, to the Wings of Life program, to what Continental has started and adopted for hometown airline, and that United will come in here and wipe all of that out based on a false premise. If it was true, okay, but it's based on a false premise. And that's the thing that I say, you know, they have to consider. That it's their threat to do so is based on the false premise that this program is causing them to lose travelers, government travelers, because it's not allowed. It's based upon price and competition.
Thank you very much. Senator Nicholas, on the amendment.
Can I just, Mr. Speaker, I have a, if I could, just to make it more clear, and I don't know if I can withdraw the First Amendment, and I want to just make it clear and perhaps just add the word "and" after Guam, after on line 7, so that my intent is clear, is that we capture both. We capture the miles that's accrued by the employee as well as the miles that's accrued on the credit card purchase.
So, okay. You're amending your
Yes.
your initial amendment, or withdrawing
Either
it,
that,
and you're instead adding "and" there and leaving
and
the
leaving that
underlined section.
That's correct, Mr. Speaker.
Now, on this amendment, Senator Nicholas, do you still wish to speak? On the new amendment? Yes. I'll wait. Okay. Madam Speaker, on the
On the
revised
new
Rodriguez
amendment.
amendment.
Yes, thank you again. And as I stated earlier, there are only 2 ways to accumulate mileage. Yes, one is through a credit card, and the other is through the actual travel. If the traveler, of course, is registered to become a member then of the mileage program. Now, it's not going to hurt in the sense that, provided that this is the only amendment, because the thing is that it is indicated here that voluntarily the travelers can then donate their miles. We're not taking that away at all. It's the mandatory part where it is going to say that they all must do this. No one could ever, none of the airlines would stop you as a traveler if you want to purchase a ticket for, like myself, I purchased a ticket for my daughter to come home for the holidays in my name. I have the mileage, and I purchased a ticket for her, and all I pay are the fees and taxes. But I don't pay a transfer fee, because there's no transfer fee. If I was to transfer it to her mileage account, then I would pay. And yes, that amount could be exorbitant. But you see, my question is, and I don't know, whether I'm going to say that I object or I don't object, because I don't know where this is going to go, and maybe I need to sit with the, because that would determine how I'm going to vote on this, unless there are other intentions to go in again and delete other stuff that originally is here. Then I guess to be in the safe side is that I'm just going to object then to the amendment.
Senator Nicholas, any other senator wish to be heard on the revised Rodriguez amendment? Senator Nicholas, you're recognized.
Thank you, Mr. Speaker. I rise in reservation of the amendment for a particular reason, Mr. Speaker, and that is that, we always talk about asking the experts and asking the people who are affected, and the Ajuda Foundation, that is overseen by Senator Carlotta Leon Guerrero, has specifically stated that the language in the bill as contained is what they support. And so all of these issues that we're afraid of in terms of losing a program or losing something here or losing something there or not counting something here or not counting something there as it relates to the existing program that Ajuda is under, Ajuda has specifically said that they support this bill. So I'd like us to keep that into perspective as we discuss and deliberate on these concerns, which are legitimate, but we need to make sure that the context of those concerns are framed properly by understanding what the actual impact is to the parties of concern. So I just want to rise in reservation of the amendment and make that statement for the record, Mr. Speaker. Thank you.
Thank you. Any other senator wish to be heard on the revised Rodriguez amendment? Senator Pangilinan.
If that is the case, and our intent here is to just solve the Azuda problem, then just, as Azuda said, you know, they can just cancel the MOU with the government of Guam, which allows transfer-free, you know, cost-free transfers to the Azuda. And because Azuda, I just spoke with, she said they don't need the government of Guam miles to help MIP and Medicaid patients, that they're going to rely on the donations from all the others. So just cancel the MOU between Azuda and the government of Guam, keep the government of Guam miles and the employee travel miles, you know, let's keep it. And then we'll figure out a way, and it still save us money. Even if we had to pay the transfer fee, a ticket would cost $1,500, $1,800. If the transfer fee is $200, $500, we're still going to save $1,000. So if that's the case, then it's the idea that we're now, you know, going to let the employee keep their miles. If our idea is to try to capture that economic resource and use it to avoid laying out cash for those travels that we can use using one pass, you know, and the accumulated miles, and we want to do that, then yes, MOU can just tomorrow say we're going to cancel, or Azuda can say, you know, the fact that you guys want to give us miles is threatening our status with United. And therefore, we are now going to rescind that MOU and not accept any more donated miles from the government of Guam Traveler. Because they're saying they don't need those miles. We're saying we want to use those miles and use what they have in place in order to transfer those miles for free. If we can't do that, we can't do that. If they don't need the miles, they don't need the miles. So cancel the MOU that allows that transfer. Azuda and United now will have no reason whatsoever to say that, you know, they're going to cancel Azuda, because they're not now affected by the fact that, you know, employees donate their miles to Azuda. But let's keep the miles that the government pays for, and we'll use it for government travel. In this case, we'll continue to use it for MIP Medicaid. If somebody wants to come along and introduce another bill and use it for education, then that's another debate. You know, I don't believe we should until we know that we are able to help every single person that needs help, that can't and don't have the resources to get off island for medical care. And when we know that we have excess miles, then let's get the bureaucracy untangled to have all of these patients access those miles and access those tickets quickly. And when we've done that and we find out we still have 10 million miles, you know, then maybe do it for other things, you know, allow it. But set up a completely different way to capture those miles and not take it away from MIP and Medicaid and the Edward J. Cruz Medical Mileage Referral Bank. So we don't even need to pass the law. Azuda, if it says it doesn't need these miles, if it wants to save its program, it's only able to do so because of an MOU. So just cancel the MOU, saying your program and allowing your employees to require them to make those, to give up their miles to Azuda is jeopardizing my status and ability to be continued as a sponsored charity under the United, you know, One Pass, whatever their mileage bank is called right now, is threatening to do so, and just cancel the MOU, and Continental United will have no other reason then to cancel that, to then threaten Azuda. Just cancel the MOU. We don't need to pass a new law. We want to keep those miles for government travel cost avoidance.
Okay, we are on the Rodriguez amendment, adding and. Anybody else wish to speak on that amendment? There's been an objection. Did you wish to? close.
Thank you, Mr. Speaker. Mr. Speaker, I think I need to make it very clear here. What I'm trying to do with this amendment is pretty simple. It's saying that we're going to capture the miles that's accrued on the credit card, on the purchase of that ticket through a credit card. That's what this legislation is saying. Sure, it's fine. That's fine. All I'm saying now, in including this word "and," is that we're going to make sure that we also capture the miles that's accrued by the individual that's flying. Nothing here is saying that we're going to still jeopardize the Azuda Foundation. And I said it earlier. Those provisions are listed later on in the bill, and I have no intentions of undoing those strike-throughs. So if we're saying, we got the testimony saying that because current law says that you must turn it over to the Azuda, and it's jeopardizing the program, then fine, let's take it out. And that's what this bill calls for. Even without my amendment here, Mr. Speaker, that's how this bill is. That's how this bill is set up. Is that they are striking through the requirement to mandatorily have our employees deposit to the Azuda Foundation. So that's fine. That's what this bill is already doing. So all I'm saying with this amendment is that we're going to capture now not just the ticket, the miles on the ticket, but on the actual flight that is accrued.
Thank you, Senator Rodriguez. There's been an objection. I'll call for the vote on the amendment to add "and." All those in favor of the amendment, please indicate by raising your right hand. The amendment passes. Senator Rodriguez, you still have the floor.
Thank you, Mr. Speaker. Mr. Speaker, now that that amendment passed, I would like to, I don't know if we have to do it one by one, but now have that reflected on everywhere else that it says that where this language is similar in nature.
Thank you. Legal counsel is instructed to make the requisite amendments throughout the bill. Okay. Anything else, Senator Rodriguez?
Yes, Mr. Speaker. Mr. Speaker, on page 5, of the bill, it lists how we are to divide miles that's accrued. And first one up, Mr. Speaker, is the Department of Administration. It says here, 50% of the accrued mileage maintained by this entity shall be used to send eligible students to participate at off-island academic activities, and so on and so forth. I would like to, my first amendment here, I'd like to amend it to reflect, I don't know if I can get help from legal counsel, but my intention is that all travel, all mileage that's accrued through travel through the purview of the Department of Administration, that 100% of that remain with the intended on what is current law, which is for use for medical purposes. And then I'll have some other amendments for the rest.
Okay. The amendment being proffered by Senator Rodriguez is on page 5, item 1, to have this section amended so that all 100% of the mileage goes to medically indigent travel. Is
Yes,
that correct?
and Mr. Speaker, yes, if I can just explain a little bit further. Yes, that's the intention, is that, so what I'm trying to say is that it stays status quo. On the travel that's being conducted now that is under the purview of DOA, that everything remains the same, that all that miles that's accrued stays for medical referral patients. And I'm doing that because as we go down further, what I like to do is still, because just like I said, I'm not trying to, this is not an attempt to put an amendment to gut this bill.
No.
And so,
I understand that.
okay, I just want to say that we can,
I'm
you
just
know,
concerned that if Adjuda takes Senator Ben up on his suggestion to cancel the MOA, the current law would mean that it would, the current law is that that the medically indigent travel is through Adjuda. And I think if you take Senator Ben's suggestion that Ms. Paris, the treasurer, put on her own, just decide she's going to, with the credit card, yeah, with those credit card miles, could just on her own purchase tickets for patients. I'm not sure if you're going to capture that in your amendment. But anyway.
okay, but Mr. Speaker, yes, I understand that, and so perhaps I can request for a brief recess so that we can get that clear.
Okay, thank you. That we're going to take a short recess. a lunch recess until 2 o'clock.